Welcome to the Men's Health Lunch and Learn. My name is Jerrod Tarman. I am the program manager here at LOLfit on campus, and Chelsey will join us shortly. She is the nurse practitioner at LOLwell. First time we did this, I forgot to hit the record button on the first half of the presentation, so she will pop up in a few minutes. Well, today, the outline is going to be we are going to talk about the men versus women life expectancy, the leading causes of death, the risk factors of those causes, the mental health and self-care, cancer prevention, immunizations, vascular disease screenings. So life expectancy between men and women, life expectancy varies pretty greatly. So the life expectancy at birth by sex in years for 2019, men in the US live to be about on average 76.3 years old and women 81.4 years. So as you can see, there's a difference of about 5 years. And for country averages, so countries that are similar to the US and a lot of things like Switzerland, Sweden, Japan, Australia, Netherlands, their country averages are about 80.4 years. So about 4 years longer on average, those countries live. In women, 84.7. So again, about 3.5 years longer. So why is America different than the rest of the countries in the world? We'll talk about that today. And then over 100 years old, of that population, only 17.2% are men, and women take up 82.8% of the people over 100 years of age and older. So the leading causes of death in men, as you can see, cardiovascular disease is almost 25% of all deaths of men. Cancer is 22.5, unintentional injuries is 7.4, chronic lower respiratory disease is 5.2, stroke is 4.2. Diabetes is 3.1, Alzheimer's is 2.5, suicide is 2.2, which is about almost 4 times more men commit suicide than women. So again, we're going to talk about that mental health part coming up shortly. Influenza and pneumonia is 2.1, and then kidney disease is 1.8. So again, some of these are genetic causes, but also some are preventable. So the risk factors, so things that you can control when it comes to your health and different risk factors are smoking, your diet, your exercise, your alcohol intake, and then your stress management and mental health. I know the last one there's, easier said than done. Well, all these are easier said than done, but especially the last one, stress is kind of a challenging one to do, and we'll talk about more of that later. And then what you cannot control, your age, your gender, and your hereditary. So when it comes to your diet, so a lot of overweight leads to a lot of those causes of death. So managing your weight, so what that entails is understanding your calories. So how much should you eat? If you look on the right, you can see weight gain. In order to create a weight gain or increase your size, your calories eaten is greater than your calories burned. So you are consuming more energy than you are putting out. Balanced weight means you are consuming the same amount of calories as you're burning, and then weight loss, you are burning more calories than you're eating. So it's basic science, right? So if we are gaining weight, that means we're eating too much. If we are losing weight, we aren't eating equal to calories burned. So if you're thinking you're gaining weight, but you're not eating too much, more than likely you are eating too much. You just aren't realizing how much you are consuming. So how much individually should I consume? So there's this link here. I'm going to click on it. I will share this so you can see it. So tdeecalculator.net. So TDEE stands for total daily energy expenditure. So how many calories, how much energy are we using throughout the day? So you can go to this website, put in your age. Just going to do a average male, roughly average. So age is 45. Their weight is 215. Height is 5'11", and their activity level is sedentary. So it means they're just going to their work. They're doing their normal day. They aren't planning, their exercising throughout the week. You can adjust these to your individuality. If you do exercise, I'm just going to do sedentary because most of people are. And then you can also do your body fat percentage if you know that. If you want to know that, you can come visit us at the fitness center. We will do that for you so you can get a better idea of where you're at. But he'll calculate and it'll come up with this information. So keep in mind, this is a number based on a formula. So it's not 100% accurate. It's just a good starting point to get an idea of how much you can eat. And then you can kind of tinker with it as you go. So for a person who is 45, 215 pounds, 5'11", they are sedentary, they should consume 2,259 calories per day to maintain their weight. So keep in mind, these are just maintenance calories. These aren't trying to gain weight. They aren't trying to lose weight. This is just to stay where you're at. So if you're happy at 215, you're healthy at 215, the doc says you're at a good weight, this is what you should consume to maintain your weight while in a sedentary lifestyle. If you do exercise that day, you're allowed to bump up your calories a little bit more just to maintain, if your goal is to maintain. If your goal is to lose weight, then you want to take about 500 calories off of that. So if your goal was to lose weight while exercising twice a week, you should consume about 2,088 calories that day. And again, if you're trying to gain weight, you want to do it the opposite, where you want to add 500 calories per day. And again, depending on your situation, there are people that need to gain weight. So keep that in mind. This is what you should consume while you're maintaining your weight. And you'd be surprised how quickly some of this stuff adds up, especially if you're eating those not so healthy calories. Let me switch back to the PowerPoint. So, and the factors that affect calorie intake would be your weight. So the more weight you have, the more calories you will burn throughout the day. Your activity level. So if you are more active throughout the day, your muscle mass takes more energy to maintain. The age, and then your gender. So keep that all in mind when you are factoring how many calories you should be consuming. Again, if you have any questions on this, reach out to myself. I'll be happy to answer those more specifically towards you. And then of those calories, how many grams of protein do I need? How many grams of carbs and how many grams of fat? So a lot of this stuff, I'm not going to go too deep on this just because, it's important, but again, the total calories is more important than how it's divided up. So if you look at this chart, 50% of your calories should come from carbs, protein should come from, or 20% should come from protein and 30% from fat. So you want to consume about 0.36 grams per pound of body weight. So whatever your body weight is, you would multiply that by about 0.36, and that's the amount of grams that you should get. So if you were 200 pounds, you should get 72 grams of protein. And then when looking at your plate, this is kind of what it should look like. This is from choosemyplate.gov. So again, half that plate is fruits and vegetables. A little over a quarter of that is grains, preferably whole grains. And then protein is about 20 to 30%. Research has shown that if you are trying to lose weight and maintain muscle mass, to increase your protein to about 0.6 to about 0.8 grams per pound. So again, almost doubling that if you are trying to lose weight or change your body composition. has shown to help. And then exercise. So your goal for the week should be 150 minutes. That might seem like a lot, but that's only 5 days a week for 30 minutes. So there's a couple ways you can break that up. 30 minutes, we're all busy. It's tough to kind of schedule that time in. But exercise doesn't just need to be, planned in the gym. Exercise can be just going for a walk, walking the dog, doing yard work, doing stuff around the house. Just, anything that increases your heart rate is technically exercise. Your body doesn't know, whether you're weeding the garden, getting up and down, pulling a wheelbarrow versus, in the gym. Your body doesn't differentiate between the two. As long as you're increasing your heart rate, moving around, your body's going to see that as exercise. So example 1, moderate intensity aerobic activity for 50 minutes. So that's 5 days a week for 30 minutes and 2 days of full body lifting or working all those muscle groups. Again, doesn't necessarily need to be in the gym. Being in the gym is the most efficient way. But again, if you're out, doing stuff, lifting stuff, it's be the same thing. Example 2, if you kind of don't have the time for the 150, or if you just want to increase the intensity, you get to decrease the amount of time spent exercising. So if you're jogging or running, you can do it for 75 minutes. So that's 1 hour and 15 minutes every week. So you can break that up however you want to. Anything that's going to get your heart rate above that 65% of your max heart rate. So anything above like 120, 130 beats per minute is considered vigorous activity. And then also doing 2 or more days of all major muscle groups lifting. For example, 3, a combination of both. So say one day you walk the dog, and then the next day you go for a jog. You can combine those two to get your exercise. And then you'd also go in between those, maybe like 100 minutes of exercise if you're combining those two, and then 2 days of all major muscle group workouts for strength training. So always get 2 days of lifting. Research has shown that that's increasing the longevity of individuals' lives. Having that muscle mass does a lot for our health.
So the next thing I wanted to talk about, and this is where some of our empty calories come from, is alcohol intake. And we've definitely seen a huge uptick in alcohol intake during the pandemic because people have been home. And so they can be home having a glass of wine or 2 or 3 or 4.
Absolutely.
And so we've definitely seen a huge uptick as a community regarding alcohol intake during the pandemic. And now the holidays are coming and we'll probably continue to see that uptick in trend. And so just to kind of address what that looks like, there's a lot of empty calories associated with alcohol. So when people are looking at where did all these pounds come from during the pandemic, we did see an average of between 15 and 20 pound weight gain for people also during the pandemic, just because of the decrease in exercise movement, as well as I think, especially more time at home, people have more access to the kitchen kind of throughout the day. Absolutely. Instead of regular scheduled meals. So one of the things that I talk a lot about is going back to those regularly scheduled meals, looking at that plate that Jerrod had up a couple slides ago, really focusing on, okay, if you look at that plate, there's a half of that plate is vegetables and fruits, and only a quarter of that is our protein, and meats. So really looking at our portion sizes, and that does include alcohol. So we know that 1 in 5 people were drinking unhealthy amounts during the pandemic, which is an increase from 1 in 6 to 7 that we saw prior to kind of the pandemic starting. And really what we'd like to see is people, limiting alcohol 1 to 2 drinks per day on average. You can't save them up, unfortunately, for one night a week, and not consuming more than 4 on any day. And really, once we hit that 65-year mark, our body is not able to process alcohol as easily. Our liver is what processes alcohol. And so we're really reducing that amount to more than 7 in a week is really too many, and certainly not more than 3. So The other thing in men that I really wanted to touch on, because we have seen an increase in mental health concerns throughout pandemic, and I really wanted to talk about that and just educate people about really what is depression, because I do get that question, like, what are the symptoms of depression? Like, how is that really actually diagnosed? And so I wanted to talk about symptoms, and that kind of is symptoms persisting for 2 weeks consecutive or even longer, changes that we see in sleep. So difficulty falling asleep or waking in the night, changes in appetite. So eating a lot more than usual, eating way less than usual. So kind of extremes on both sides. Just a lot of difficulty concentrating on work, feeling distracted all the time, feeling distracted at home with our families, really just not enjoying things that we normally should be. I really used to love watching sports on TV. I used to love cooking or preparing dinner for my family. I don't actually care. Those are symptoms that you're like, oh, this isn't me. Looking at things kind of in a hopeless way, like, oh, I'll never get this new job. I'll not get the promotion. Not maybe even wanting to get out of bed and getting going in the morning. Oh, it doesn't matter if I miss this meeting, or I'm not going to go to that, or I'll skip my kids' sporting event. Like, it's no big deal. And when you notice that those things are happening when you never used to do those things, it's like, oh, this is not me. That's a sign. Changes in movement. So just feeling like you're moving more slowly than usual, having more physical aches and pains. And then the last one is having thoughts of self-harm or suicidal thoughts. So oftentimes depression can be a really big silent struggle for many men. They have to hit bottom before they reach out for help at all. And really what I want to talk about today is that there's many things that we can do to treat depression. There's lots of treatment options, and we really want to change these statistics.
Mm-hmm.
So talking about mental health, 4 in 10 adults reported symptoms of anxiety or depressive disorder, and that was up from 1 in 10. So this was a significant increase that we saw. Yeah. That is really a lot. And this is something that we're paying really close attention to. So I really wanted to touch on this during my talk because I feel like this is really important. There's a lot of resources that we just have right here on site at Land O'Lakes to help with mental health, or even if you just are concerned and want to be screened, that certainly is something that we can do here. So we have Cassandra Gomez here with us. She is a counselor and she's here Monday through Friday. I am here as a primary care provider, and there's also Lyra, and all of these are linked in your source in terms of access and how to make appointments. But Lyra is a company that provides you with a counselor within your own home network. And again, for both options, whether it's Cassandra or a counselor that you locate through Lyra, 12 sessions are covered per year. So the average number of sessions for somebody with counseling is around 8. Sometimes it's more, sometimes it's less. But again, a lot of times what I'm finding is that people just need to invest their time to feel better. It's not a financial burden, which a lot of people feel like it would be. Yep. So we really are trying to educate people about that too.
And you don't necessarily need to have these symptoms to attend these Lyra or LOLwell with Cassandra. It's good to just talk to somebody. If you're going through anything that, you just need an ear or talk through, they're definitely there to help as well.
Yeah, so things like life stressors, life transitions, yep. Grief. Cassandra does a lot of work with marital counseling.
Yes.
So there's a lot of different reasons why this would be a helpful resource.
Yes.
All right. And so that kind of transitions us into self-care and the importance of that. And that is a big focus for us for December at the LOLwell. And so we really want to take care of ourselves mentally and physically so our body can keep up with the life that we have planned. So many of us have lots of plans for our lives, whether that's our families, our work, trips, different things that we're looking forward to after this is all kind of wrapped up. And so we want to make sure that we're feeling well enough to do those things and enjoy those things. So self-care is really something that's necessary. It helps us with resilience during our difficult life moments. It helps us with stress management. It lowers our risk of long-term illness. Our stress levels are very interconnected with cardiovascular disease and diabetes. That increases our cortisol levels in our body, which creates insulin resistance and also leads to narrowing of our arteries, which can lead to problems cardiovascularly and also with diabetes. So we really want to manage our stress and participate in self-care every day. And it also helps us feel better. We increase our energy. So that's a great thing too. So we want to feel good every day, and we want to feel good long-term. So the 4 C's of self-care I just wanted to touch on. So the first one is just really connecting with yourself. So, you know, on a day-to-day, weekly basis, we want to find opportunities to check in with ourselves emotionally, see where our life has taken us, you know, examine kind of some of the things that have been difficult and how we handled it, examine the things that are good and how we handled it, and where we want our life to go. So that's really a helpful tool to kind of guide our life in the direction we want it to be going. The next one is connecting with others. When we connect with others, we find comfort in knowing that they're going to be there for us when we need them. And it also really creates a social network of fun activities, things that we look forward to in our lives outside of our work, and really helps us with work-life balance. The third is connecting with our community. So when we donate our time and energy to help others, this links us to kind of the world around us. And a lot of people are like, why would I volunteer? And it really does create that sense of gratitude within us. It helps us feel better about ourselves. It helps us feel better about our community. And as we kind of move forward through this pandemic, building community is a really valuable resource. That's for sure. We need more of that. I think it's really difficult when we watch the news, or some of the things that we're seeing on social media really can bring us down. And so one of the things that we have in our 31-day self-care challenge this month is just to take a break for a whole day, like no social media, no news, just take a break from that and really put on like your favorite podcast, binge watch your favorite show, do the things that really bring the joy and the happiness. So we really want to create that joy and satisfaction in our life and find opportunities to live our best life. So that helps us to create the moments in our day that we look forward to. And this wards off that kind of what I was talking about before, where it's like we just aren't enjoying the activities that we normally do. It really helps us put one foot in front of the other to create our best life and to have things be what we'd like our life to look like, instead of kind of feeling stuck, if you will. So we want things to not look the same every day. We want to create variety and fun things that we plan and look forward to. All right. So the next thing that I want to talk about is when your last checkup was. So in general, a lot of times these we recommend annually. For different age groups, you know, sometimes there can be some space in between, but usually I like to see somebody in the clinic every 1 to 2 years for sure. And kind of in my next slides, I'll talk about different screenings that we do at different times in your life to keep you as healthy and well as we can. So that just helps us check in with you every year on how you're doing with your weight, how you're doing with your blood pressure, how are you doing with your mental health. So we do what's called a PHQ-2 screening, screening for depression, and then we go beyond that if we need to. We usually look at your cholesterol and glucose numbers and spend some time talking about things that we can work on. So I really feel like that annual physical is a really great opportunity to check in with ourselves, both with our physical and mental health, and make sure that we're on the right track to keeping ourselves healthy. So when we talk about blood pressure, this is something that is really something that I am very passionate about, because my background before I became a nurse practitioner, I worked in a cardiac ICU, and I also worked in an open heart surgery team. And so I spent a lot of time thinking about everybody's hearts every day. And really, when we think about blood pressure, it's a hugely important concept, because the pressure is just like the pressure that comes out of the water in our sink. And so when we think about our heart and we think about our heart beating, you know, 60 to 100 beats per minute. So every time it beats, it has to overcome the force of our blood pressure. And if we increase that pressure every beat, it has to work harder. And what happens is, if we don't keep that blood pressure in check, we really put extra strain on our heart all day, every day. And over years of time, what happens is our heart really feels tired and exhausted, trying to overcome that pressure with every beat. And so it changes its shape. It becomes more boggy. It doesn't pump as efficiently. It increases the muscle mass within one of the chambers of our heart that pumps that blood out. So what that does is that decreases the amount of blood that's able to be pumped with every beat. And so then all of a sudden our heart is like, oh, I got to beat more frequently to be able to pump more blood. And so it really becomes this vicious cycle of kind of wearing out our heart if we don't treat that blood pressure. So what do we want to do? We want to have blood pressure screenings at least every 3 to 5 years when we're 18 to 39, and we want to check it every year for sure when we're 40 and up. What happens as we age is that our pliability of our blood vessels decreases. They aren't as stretchy and flexible, kind of like our bodies as we age. And so they also, that creates resistance within our arteries, and so that increases our pressure. And that's why lots and lots of people struggle with high blood pressure. This is also a hereditary thing, but we have lots of things that we can do to help with blood pressure. So diet, exercise, and medication also is a great tool to help with blood pressure. So we keep lowering that goal a little bit. It was 135/85. We're now at 130/80 as being kind of the ideal blood pressure at or below. But, you know, for certain individuals, we have to, you know, tailor treatment. But in general, that's kind of the guideline that I'd like to follow. And so with blood pressure, really what follows blood pressure is a high salt diet. Salt tends to retain fluid for us, and that increases our volume, and that is going to increase blood pressure. So one of the first things that we talk about when you're kind of borderline or running high with that blood pressure is to decrease that salt intake. So, you know, somewhere around 2 grams or so a day. It's a lot of numbers to kind of keep track of. But, you know, in general, just getting used to not salting our foods is a great way to start with that. And then limiting our meals out and preparing our own food more often than doing takeout is also very, very helpful. So that's just kind of some things to keep in mind surrounding the blood pressure. So the next thing I want to talk about is cholesterol. So we do that screening here in the clinic. It's a simple finger prick. And it takes about 15 minutes to get that test back. But we're really wanting to do that at least every 4 to 6 years. I do it annually for a lot of my patients. I feel like it's helpful for them to be able to visualize those numbers, especially if they've gained a lot of weight or they're doing a lot of exercise to try to improve their numbers. We can kind of track that. So every 6 months or so, sometimes I check that for people as well, depending on what's going on with their activity levels and lifestyle changes. So if you have a poor cholesterol, it is very interconnected with diabetes, heart disease, sorry, that's a typo, high blood pressure, peripheral vascular disease, and stroke. So when we look at our cholesterol, we're looking at lots of different numbers when people come in and see me. These are just general guidelines. So when we think about our total cholesterol, ideally we'd like that to be below 200, depending on where our HDL is. So our HDL is our happy, healthy cholesterol. The higher that number, the better. So if we have HDLs in the upper 60s to 70s, and we see that cholesterol slightly over 200, then we're not so concerned about that. But if we're seeing that HDL in the 40s and the LDL, which is our low density lipoprotein, so that's the one that's really leads to the atherosclerosis and the plaque buildup that we see in our arteries over time. So we want to keep that LDL for sure below 130 in patients who are not diabetic, and below 99 in people who are diabetic or borderline diabetic. And then again, like I was saying, the HDL, we want that as high as we can get that. And then our triglycerides, ideally, we're going to see those below 150. And those are the fatty acids that are in our blood. A lot of times, you know, eating a diet high in saturated fat, a lot of fast food type takeout foods can really increase our triglycerides. And then the other element with cholesterol that I always touch on is genetics. So high cholesterol is a very familial trait. And so I do see lots of people who do all the healthy things and they still have high cholesterol. And so there's a lot of different strategies that we can implement to improve cholesterol. But from a dietary standpoint, the carbohydrates, so when we look at that plate again, going back to that, a quarter of those foods that we're intaking for especially lunch and dinner are supposed to be carbohydrates, or can be, they don't have to be. We want those to be high in fiber. because that really does help lower the cholesterol. And we also want foods that are rich in omega-3s. So nuts for protein, and then fish like salmon, any actually fresh fish that's not fried is helpful for that. And then also things like flax.
Yes.
All right. So when we manage our cardiovascular risk factors, I just kind of touched on all of that. So whole grains, beans, almonds, apples, pears, walnuts, those are all things that really can help increase our omega-3s and increase fiber in our diet. So really what we're shooting for with fiber is going to be 25 grams or so of fiber a day, which when you watch your foods, it's actually, you really have to work at it to get in that 20 to 25 gram range. And that will help lower cholesterol. So that's something that I really recommend in that regard. Getting plenty of exercise also will help increase our HDL and lower the LDL, and also staying a healthy weight. Quitting smoking is a huge one. That is something that I spend a lot of time educating on, and that is something that we can help with in the clinic. There's a lot of medications. There's also different things that you can do yourself in terms of helping with quitting smoking. There's a smoking quit line through Minnesota, lots of programs that we have to help people quit. Managing your blood pressure and then keeping that glucose under control is also very, very helpful. So diabetes prevention. So blood glucose tests measure the amount of sugar in our blood. So we do have that point of care, also that finger poke test right in our clinic, as well as an A1C, which kind of is more of a snapshot over several months of what your blood sugar averages per day. So the recommendations for testing for that is really an initial test between 19 and 44 if you have risk factors, and then every 1 to 3 years based on those results. And then if you're 45 and older, for sure, every 3 years. But if your blood sugar is above 99 but below 126 in that pre-diabetes range, we really like to see you back every year to make sure that that's not continuing to climb up. And then tips for diabetes prevention, again, it's diet that's high in fruits and vegetables and the whole grains, and keeping our weight healthy and normal range and staying active is also very, very helpful. So for cancer prevention, we're really wanting to think in a different way about different things that we can do. And this is something I touch on with everyone in their physical exams, is looking at what we can do for cancer screening and prevention, and really an important component of our wellness. So we're thinking about always avoiding tobacco. We know that tobacco is the #1 cause of all-cause cancer, whether that's colon, lung, and different kinds of other more rare forms of cancer because of the carcinogenic materials in cigarettes. We're at like 300 plus chemicals in cigarettes. And this is really, unfortunately, unhealthy for our healthy tissue and cells within our body. And quitting smoking, this is reversible for sure. And so it's never too late to quit, to have some health benefits to that. Because sometimes I got that, especially when I was in ICU, I would see people who had been, 20, 30-year plus smokers, and they're like, oh, it's too late to quit. And it isn't, it actually isn't. So we want to be also physically active, maintaining that healthy weight, eating fruits, vegetables, and whole grains. Those contain our antioxidants. So really very bright, colorful fruits and vegetables have lots of antioxidants that help prevent cancer cells. Avoiding excess sun exposure. So that's more when we think about skin cancer prevention and melanoma. We also really want to use SPF 30 or higher for especially our exposed area. Even in the winter on our face, that can be helpful, especially if you're a fair-skinned person. Really making sure that you're using those sunscreens to help prevent melanoma. With the ozone layer decreasing, we definitely know that the UV rays are more intense, and we're definitely continuing to see increased incidence of melanoma. And I know that there's still those people who love those tanning beds, especially in the winter, and those are also very damaging to our skin and definitely increase our risk for melanoma. The other thing I really wanted to touch on this slide is the colorectal cancer screening. That has decreased from age 50 to 45, and insurances are covering that screening. So having that colonoscopy now starting at age 45 for your initial screening instead of 50. Lung cancer screening, so annual low-dose CT scans are recommended for people who are 50 to 80 who are at high risk. So these are our smokers that have been currently smoking or quit in the last 15 years, but were heavy smokers. That does prevent lung cancer for sure. That early detection is key. Prostate cancer screenings, we discuss this with every patient starting at age 50. For African Americans, this starts at 45. And for people who are high risk, especially if you have family history of prostate cancer, then that discussion usually starts sooner. And these guidelines keep changing and evolving. Unfortunately, that PSA test is not perfect. We'd love to have a more specific cancer prevention tool for our prostate cancer screenings, but right now it's the best thing that we have. So a lot of times in average risk men that I see for physicals, I like to get just a baseline, and then we can check it every few years at least, or check it if they become symptomatic at some point. So then we know, oh, there was an elevation, or we saw an elevation in that. So it's a screening tool. We definitely know it's not perfect. Sometimes people who have elevations end up with negative biopsies and testing, and that does create some stress and anxiety. So that's part of that discussion that we have with every individual. However, we also don't want to miss a progressive form of it. So it's kind of a balance, unfortunately. I'm hoping in the future that our technology evolves and we have a better test than what we have currently, but this is what we have for a tool right now. All right. Immunizations, this is kind of a hot topic for us this month. Just so you know, I'm going to address that because we are giving COVID boosters. So that's the last one on the slide, but I'm going to start with it because it's heavy on everyone's mind with the Omicron variant that now has been announced this week, and just the encouragement that we're getting from the CDC regarding getting those boosters. So we are giving the boosters at LOLwell. All you have to do to get one is call to make an appointment. It needs to be 6 months since your last COVID injection, and it can be any vaccination that you got. So if you had Janssen, Pfizer, or Moderna 6 months ago, you can get the Moderna COVID booster that we're giving. If you're more comfortable sticking with the same vaccine that you had for your first dose or first 2 doses, that's perfectly fine. And you can do that as well. So there's no right or wrong to the booster schedule or the vaccine that you're choosing for your booster. We also recommend that you get the flu shot. Definitely this year, we want you getting the flu shot because we know that flu was heavier circulating in the southern hemispheres during their wintertime months. And we want to keep people as healthy as possible through this. Someone has a question?
Yeah, this is Arun here. So the question is regarding the vaccine. You mentioned that we can have it at LOL, right? So if I'm not enrolled in LOL plan, still can I get the vaccination at our campus?
Yeah, so your question is, can they get their initial COVID vaccination?
No, I need to get my booster. My
yes.
question is, even though I'm not enrolled in Land O'Lakes medical plan, I'm on my spouse medical plan, still I can get the vaccination at the campus.
You can still come and get your booster with us. Absolutely.
And it is available for the family as well?
For spouses and dependents, yes. Mm-hmm.
Thank you.
So we are giving, though, just to clarify, we are giving Moderna only, just because the storage of that vaccine, we can accommodate that. We don't have an ultra cold freezer and we don't have space for one. So we are just doing the Moderna COVID-19 boosters and vaccinations, both. And so those are for 18 and up.
Thank you.
So we do recommend the annual influenza, and we do have flu shots still left in our clinic, and we can combine those with your COVID shot. We also recommend that men are now immunized for human papillomavirus, Shingrix, and that's a 2-part injection series. We also have that one in our clinic, and that's for 50 and up. The pneumococcal vaccination for 65 and up. Meningococcal, that is a 2-part injection series. And then the Hep B series is a 3-part injection series. So we recommend that all men have these vaccinations. And then lastly, the abdominal aortic ultrasound is also recommended for any men who are 65 to 75 who are former smokers. So this is an ultrasound that's done in your abdomen, not in your heart. So sometimes people are confused about that. So your aorta runs from your heart all the way down through your belly. And so that is the ultrasound for that. So that is also a recommended screening for men who are in that age range. All right.
So how can we help? So LOLfit. So we have different health promotion programs throughout the year that are kind of based around what we just talked about. We do offer PEPs, which are personal exercise programs, which for those who are intimidated by starting a workout program or don't know what to do or have questions, we can sit down one-on-one, discuss your exercise goals, your past exercise experience, and then any injuries that you might have. And we're able to kind of guide you through an exercise program that's right for you. We do fitness testing. So if you are on site, we can bring you through different various fitness testings to make sure you are up to par with the standards. And then we also do skin fold testing. So we're able to understand where your body fat percentage, how much lean muscle you have, how much adipose tissue you have. And that kind of helps us figure out a proper diet for you. So we do nutrition counseling too. So we're able to talk you through that, explain a lot of the things that we talked about earlier, but in more detail and kind of assist you with the whole process throughout that. And all that stuff is included with your membership. For a virtual membership, it's $10 a month. So it's extremely affordable. You get a lot of information, and that's what the LOLfit can do.
All right, perfect. And I wanted to talk about the services that we have available at LOLwell. So we already talked about the COVID-19 boosters, but we also do flu shots and Shingrix there. We have Rochelle Ani with us. She is a physical therapist here on Tuesdays, Wednesdays, and Thursdays. So she is a self-referral person. So you don't have to see a medical provider or have an order to be able to make a physical therapy appointment. So if your shoulder or your back is bothering you, or dizziness is also something that she treats, those are appointments that you can just make directly with her.
And those are virtual and in person as well.
Yes, they are. And then we also have Cassandra Gomez. And like I said, she's with us Monday through Friday. Her sessions typically take about 50 minutes. And again, just able to call and make an appointment. She does offer both virtual and in person. And I will say all the virtual visits are covered at 100% through the end of this year for sure. We also offer biometric screenings. Those are $8, and that includes height, weight, blood pressure, and your lipid and glucose screen. And that's just a finger poke test. We do blood pressure screenings for free, and we also do the annual physicals in addition to ill visits. So these are our resources. I want to check in with everybody and see if anybody has any questions for Jerrod or I.
Yep. And you can email us too as well if you have a personal question that you don't want to talk for anybody. Our emails are on the source.
All right. And then lastly, we have a prize. So oh, happy day. And we want to congratulate Grayson. Is he on with us? There he is, Grayson Smith. Grayson, if you'll just stay on with us after, and we'll get your address and you will get your Burt's Bees prize. Thank you so much for joining us for this talk and for Men's Health Month.
And if you have any questions, reach out to Chelsey or myself, and we're happy to answer any questions you might have.
Thanks for joining, everyone. Have a wonderful day.
Appreciate
Thank
the
you.
input.
Thank you.
See you later.
Thank you. Thanks a lot. Bye.
Thanks.
Bye.
Thank you.
All right. And if you're here, Grayson,